Hi guys, good night to each and every one. Thanks for tuning in to my broadcast. Welcome. Remember to like, share, and subscribe. Remember to hit the notification bell, to tell a friend. Come on over, guys, and enjoy the forum. Remember, this forum is based on nothing but positive vibes, positive energy, and we're gonna talk on things that happens on a daily basis in our life. So there is topics that will relate to our everyday life. Okay guys, so remember to tell a friend, tell your auntie, your uncle, your sister, your brother, your grandfather, your grandmother, and even the dog to come on over and enjoy. Okay, so today's topical discussion, guys, will be on our oral health or our oral maintenance, right? So oral hygiene is a practice, right, in which one keeps its mouth clean and free of disease. Okay, so we practice our oral health by keeping the mouth clean and free from diseases and other problems, right, such as caries, decays, gum disease, right, bone loss. Those things we try to keep a proper hygiene so that we avoid all those things, guys. All right, so brushing the teeth is very important, right? And cleaning between the teeth are very important. It is important that oral hygiene or oral maintenance or oral health can be carried out on a regular basis, right, to enable prevention of dental disease and bad breath. Yes, it is true. It's very true, guys. So that's why you will see at times your dental offices, they are calling to schedule you in or to book you in an appointment so that you can get your annual maintenance up to date, right? And sometimes you will see some people, based on their insurance, they will be on a 6 months retroval or a 9 months retroval due to their insurance. All right, guys, so please, guys, remember to be updated with your oral health. It's very important. This oral health will also help the dentist to do a proper diagnose, and so that they're able to catch things on time before further problems starts to manifest, right? So sometimes when you go to the dental offices and you get your cleaning done or your maintenance, because we call it oral maintenance as well. So when you get all that done, the dentist will come in after and they will do a thorough check to make sure all is well, your teeth are properly being maintained, there's no cavity, you're cavity free, right? There's no diseases going on in the mouth, there's no bone loss, right? So sometimes when we have bone loss, guys, sometimes it's because we have gum diseases, and not only that, because we have missing teeth. So when we have missing teeth as well, right, in certain areas of the mouth, we start having bone loss, bone density. Okay, so guys, let's talk about what is a comprehensive examination. So a comprehensive examination, it is actually determined as an exam which is essential, which prevents dentistry, with like a preventive dentistry, which is the practice of preventing oral disease, right? So that examination, remember, oral health is important. So your comprehensive examination, guys, it's very important to have. And this specific examination is only done every 5 or every 3 years, depends on your insurance. It's important to have. Your recall exam is a little bit different. It's an exam as well, but your comprehensive exam, it goes more in depth. It goes thoroughly in depth, and I'll tell you why your comprehensive exam goes more in depth, right? So this type of examination, it is performed because it's preventing oral disease and caring for your teeth to keep them healthy. Your exam is usually conducted during your initial visit, right? So the baseline, why this exam is also used, it helps to formate the groundwork for any future recommendations or treatment plan that needs to be done. So this examination is an aspect of oral health to determine any treatment or preventative measurements which is needed. All right. So usually before this examination, right, what's included in this examination, this comprehensive examination, you will have your medical history updated, you'll have your dental history updated, basically what it is asking you for, if there's any changes in your medical health, right? Is there anything that we need to know about your health wise, what medication you're on, any allergies, did you have any surgery done, stuff like that helps the dentist, right? All those information is very, very necessary. It helps the dentist, right? Sometimes the medication that you're taking can cause, other issues as well. So it's important so the dentists know that, right? Any current or previous complaints, such as if you have any concern prior to your teeth, if you're noticing something that it's never been there before, right? And any cosmetic goals. So for example, like if you're very conscious of your teeth and you see something that you don't like, then you can point it out to the dentist as well, and the dentist will sit and talk with you, do a consultation, and they will refer you to what is the recommended treatment in order to fix your concern. Okay, so that's basically what takes place during this type of examination. Also, your probing depth, your periodontal charting is done. So when I say periodontal charting, when you at times you'll see like they're actually using their instruments and like they are measuring along your gum line. They're measuring to make sure everything is properly maintained up there. You don't have any form of gum disease going on in there. You don't have a lot of pocketing going on. Pocketing, sometimes the food particles get trapped inside, all these type of things. And sometimes you'll hear them calling out some numbers when they are going around, the teeth. So sometimes you'll hear they say 1, a 2, a 3, right? Or a 4. So anytime you hear 4 during your pocketing depth, that is the borderline, right? To have a healthy gum, right? You should be between 1 to 2, 3 at least. 4 is borderline. Anything over 4, like 5, 6, 7, 8, that's a major concern. That's a very, very major concern for your gums. Okay? So all your x-rays will be done as well. Everything up to date. Your Panorex, your bite wings, your PAs, all those things will be updated, right? The iTero scan. You might be wondering, what is the iTero scan, right? So that is very, very digital at this point. So you see like how, you'll have like an imprint of your mouth itself, right? So that imprint can show you all the different digital form of your mouth, inside and out, sideways, backways, right? So that is something which is very advanced at this level, instead of the x-rays as well. So guys, it's very, very important you get your checkup done. When it's time to get it done, guys. Get it done, because it is very important. It is very, very helpful at times, guys, because sometimes when we sit back and we're like contemplating, in terms of going to the dentist, right? I know times we get busy, but we're never too busy to take care of our oral health, guys. It's very important, because sometimes, there's things that we cannot see that our hygienists, they can actually see. And by us brushing, guys, it's not everything that we're gonna get brushed away, because there's certain things that in certain grooves, certain areas of the teeth, we cannot see, right? And at times you will see they're doing a deep scaling, because they're going underneath the gums, guys, trying to clean out all those food particles from underneath. And you see, once those food particles get trapped underneath and they are not being cleaned out properly, guys, that's how at times we start having gum disease. We start losing our teeth, right? We start having bone loss. So we have to take care of our oral health. We have to make sure we do our annual maintenance. It's very important. I know at times we don't have the money, right? And I know it's for a proper recommendation is to get your hygiene appointments going twice a year, every 6 months. But because of our insurance at times, guys, with insurance, usually depending on your plan, you might be covered once every 9 months, right? But at least if you're covered once every 9 months, get it done. Get it done. And I said recommendation is twice a year. So every 6 months you get your cleaning. I understand financial wise, if you're not able to do it twice a year, at least do it once a year. At least put aside a little small change and get it done. We don't want to have canker sores. We don't want to have any gingivitis going on. We don't want to have any plaques sticking up there, all these things, the food particles trap underneath, and we start losing our teeth. We don't want to have that, guys. So get your maintenance updated. It's really important. It will also helps, right, to ward off bad breath. Bad breath. Because like I said, at times we are brushing, but we are not able to brush everything away because we cannot see everything. We cannot see. So with the help of our hygienists, they go more deeper underneath the gums to get all those things out. We are brushing at times and the food is still there, guys. The plaque becomes heavy. So get it done. Very important, guys. Very, very important. And like I was saying the other night, right? Getting your maintenance up to date. Those things can help prevent cancer in the mouth. So we have to start looking at those factors, guys, and taking care of ourselves. So I have a bit of demonstration to do tonight as well. So guys, when brushing the tooth, you want to make sure you get as close as possible, and you want to make sure you are at a 45 degrees angulation towards the tooth. You want to make sure you get the toothbrush towards the front, the top, and the back, okay? So I have a bit of demonstration here. So I have a little bit of paste on my toothbrush. This here is my little dummy here that I will be doing it on. So you want to make sure, guys, you get it as much as possible on the front, right on the front. You want to get it on the surface, right? And you want to get it as much as possible to the back, right? To the back. You want to make sure you get it as much as possible, guys, to the gum line, right to the gum line. Why to the gum line? Because we get plaques there, guys, lots of plaques by eating sticky foods, all those different types of food, guys. So we want to get close to the gum area and brush away, okay, to the top, to the surface. You didn't know your tooth have surface? Your tooth have surface. It has surface. Your tooth has surface. You will hear at times the dentist will say on the mesial, on the lingual, on the distal, on the buccal, right? You'll hear all those things. Those are surfaces, okay? Guys, and also remember your mouth, right, has to be properly aligned. Your midline needs to be properly aligned. For a proper biting, right? Your midline should align as much as possible with your lower arch, okay? So as you know, guys, so you know with your mouth, you have your upper right, upper left, lower right, lower left. So your mouth has 4 quadrants, 4 sections of your mouth, right? Sometimes when you go, you will hear them, you know, in the dental office, you'll hear them saying on your upper right, your upper left, your lower right, your lower left, you know, all these type of things. Those are the dental terminology, okay? But I just want to come here and I want to make sure, guys, you guys understand how important it is for you to get your maintenance done, guys. Please. It might sound nagging, it might sound too much, but it's important. It is for your best interest, okay? It is for your best interest. Even when you brush your teeth, right? You brush your teeth, guys. You can use a little bit of mouthwash as well. You can do that as well, okay? Guys, with your tongue, you need to clean your tongue. Clean your tongue as much as possible to get rid of the food particles, because food particles, they get stuck on the gums and also on your tongue. So you got to clean your tongue. You ever see sometimes our tongue look very white and like chalky looking or milky looking? It's because it's not properly cleaned. And also too, it's because of the medication that we are taking that can cause the tongue to be that way. But you need your tongue to be clean, guys, because you don't want to start having any form of lesions going on there, right? So you can get one of these tongue scraper, guys. Go to the pharmacy and you can purchase your tongue scrapers and you properly use it and you clean the tongue. Don't do it too rough, guys. Be gentle. You have to be very, very gentle because your tongue is very delicate. So you want to take your time, not as much gentle per se, but you want to make sure you clean it the right and proper way, right? You can also get these, guys. You can also get these tips, these little tips that massage your, it does massages the gums, and it helps, guys. So per se, if you have perio problems, right, you can use this and massage the gum as much as possible. All right, so if your dentist say, oh, you have 9mm pocketing, you have 8mm pocketing, you know, those type of things, you can use this, and this can help as well to gently massage the gums and do your homework as well. So not only using this, but you have to do your proper homework. Guys, flossing is very important. You have to floss because food gets trapped in between the teeth. And if that food gets trapped in between the teeth, it can cause decay. And once it starts causing decay, because it's trapped in between two teeth, right? It's between two teeth. So if one teeth gets affected, the other teeth can also get affected, right? So flossing is very important for us to floss the teeth. Floss between as much as possible, and to get out all those food particles that get trapped inside. So, like I said, we brush, yes, we brush at home. Yes, we do brush at home. But what you got to remember and what you got to think about is, are you able to see as close as possible or as much as possible within the mouth? Are you able to see, right? Are you able to see so that you can actually go underneath the gum and to remove those food particles? No, you cannot. No, you cannot. So getting your oral cleaning going, your oral maintenance going, it's very important. Do not wait, guys. Please do not wait until you start feeling a little bit of pain here and there. Because sometimes when we haven't seen a dentist for like ages, can you imagine all those build-ups going on inside the mouth? And at times before the dentist is even able to do anything, your mouth has to be properly cleaned before they can do anything. So if you go and you see your dentist, right? You haven't seen a dentist for like probably about say 6 years and going more, for example, right? And you have a filling. You think that filling is going to hold as much as possible, or that filling is going to hold that long on the tooth if you don't get a proper cleaning, clean away all those plaques? So that's why when at times you go to see your dentist will recommend for you to have a proper cleaning done first before you do any other form of work. It's not that they need money or trying to take your money, guys. Do not look at it that kind of way. It's not like that. They are only doing their job, and they're doing their job diligently. Because I'm pretty sure you go to a store, guys, to buy a jeans. You don't want to go to the store and pick up any jeans. You want to pick up a good quality jeans, guys, that is worth your money. Something that will last you for a good period of time before you go back to the store again to get an next pair of jeans. So it's the same. The dentists, they are actually doing their job, and they're doing it diligently in order to make sure that your oral health comes first and it is properly taken care of in the way it should be. So guys, please get your oral health checkup. Get it going. Sometimes we're wondering, and we're wondering why our breath smells a certain way, because we're not getting the proper maintenance done. There's other things that's going on in the mouth that needs to be addressed. Things that we cannot fix, but only our dentist can fix. So getting those things done, guys, it's really necessary. It's very, very necessary to get those things going. Even with your common x-rays, guys. Even with your x-rays, you update your x-rays once a year is good enough to update your x-rays. Because when you have an updated x-ray, that x-ray is able to detect anything that is hidden. So it's not because the dentist wants you to take the x-ray. The x-ray it helps to diagnose a proper treatment for your mouth, for your teeth. Not because the dentist want to have you take it. It is necessary. Without an x-ray, the dentist is not able to determine what treatment is necessarily for you. They will look in the mouth. Yes, they will look in the mouth, but they have to make sure the x-ray is there to prove their diagnose and to prove that is whatever treatment that needs to be done. It's just like you go to see your physician, and your physician sent you to do some blood work before he can able to prescribe you something. He wants to check everything thorough with your blood work to make sure he knows exactly what is happening before he can able to prescribe you the proper medication that is needed. So it is actually the same way with the dentist, guys. The dentist has to take the x-rays in order for them to do a proper diagnosis of treatment. They cannot diagnose without the x-rays. They have to see how deep the cavity is. Sometimes the way how deep the cavity is or the caries is, right? How deep it can be so deep to the gum line. it can be so deep to the fact that you will most likely need a root canal or so. So it's not that they want your money, guys. They're trying to help us as people out there with our oral health, to make sure our mouth is in good standard, our teeth are properly maintained and kept, our gums are in proper condition. We don't have any gum problems, no gum disease, no gingivitis, anything like that. And sometimes when we go to the dental office and our hygienist, they're telling us we need to do certain things for our own self as our own work. We need to brush here in certain areas more. It's because they're seeing things that you are not seeing. And at times, if they recommend you to brush in certain areas more, right? If they recommend, guys, and you don't understand why, you can ask them. They will educate you. They will tell you the reason being it's because of whatever. They will educate you. That's why they are there. They're your hygienists to educate you along the way as you go along. And when you go to your dentist, guys, don't shy away with questions. There's no such stupid questions. Questions are made to ask. Even if you feel it is stupid or it's silly, you ask. It's your mouth you're dealing with. We have to smile. We're very conscious of our smiles. We're very conscious of our teeth, how our teeth looks in our mouth. So we have to take care of. If we don't do it, who's gonna do it for us? You ever hear they say prevention is better than cure? So while you can prevent certain things, why not do it? Seeing your dentist is very important. Doing your dental checkups, your dental maintenance is very important. And like I said, you can do it. If you are financial strapped, at least get it done once a year. If you're not able to do it every 6 months, get it done at least once a year. I could have come here tonight and bring a lot of pictures and show you all these diseases and all these things that can happen in your mouth and gross you out, but I will not do that. I will not do that. I will rather come here tonight and to tell you the importance of your oral health than to show you gross pictures to gross you out with things that can happen inside of your mouth, lesions, how it look, how certain disease look inside your mouth. I could have done that tonight, but I said no. I rather come here and I rather talk, right? And to voice and to ask each and every one of us to at least see our dentist. Guys, it's easy, it is safe, and it is highly effective. We want to prevent gingivitis. We want to prevent periodontal disease. We want to prevent halitosis, right? We want to prevent perioimplantitis. We want to prevent all those in order to keep our very own teeth in our mouth. Your dentists, they're fully licensed. Your hygienists, they are fully licensed. They're equipped. They're fully certified to take care of you. I know at times we do have bad experience, guys, but it's not everyone is the same. If you have a bad experience there, you can go elsewhere, and I'm pretty sure you will have a wonderful experience when you go elsewhere. Your comprehensive, your recall exam conducts a thorough examination of your mouth for any visible dental problems. And like I said, with your comprehensive exam, you will do a little bit of your medical history to document whether you have any existing medical conditions or risk factors that could be contribution to either gum diseases or bad breath, bad mouth odor. And like I said, guys, sometimes when we go to see, we go back and they ask to come back within 6 weeks time, right? So that they can do a brief follow-up to make sure everything is going properly, guys. It's because they want to be on top of things. So if they detect or they see something, they want to make sure that they're on top of it, because those type of things helps to determine health or disease, right? That includes biofilm disclosing, measuring periodontal pockets, and recording bleeding or probing using a papillary bleeding score. Because sometimes they ask to see us back. When we go to see them, they will ask to see us back because of bleeding, the amount of bleeding that we have accumulate. And sometimes, guys, when you're bleeding so much, it's hard for them to do everything in one appointment. So you gotta be patient, because the gums are inflamed. The gum is not healthy. So guys, I hope you guys will take the initiative and start booking your dental maintenance, your oral health appointments as soon as possible, guys. So thank you guys for tuning in, and I will catch you guys at another day. And remember to tell a friend, tell your auntie, your uncle, your sister, your brother, your granny, your grandfather, and tell the dog. You understand me? And come on over, guys. These are topics that we need to talk about. These are topics that we need to discuss. These are topics that we face on a day-to-day basis, guys. Your oral health is very important. Make sure you're on top of it so that you can prevent further harm, further damage to your mouth, your teeth, your breath, right? So thanks for tuning in. Remember to hit the notification bell. Remember to like, share, and subscribe. Tell a friend, and I will catch you soon. Good night.